Today, Labor commits to an Australian first. Nurse-to-patient ratios entrenched in New South Wales emergency departments, paediatric wards and resuscitation beds within emergency departments. Wherever I go around the state and talk to nurses, their number one request of our state government is to introduce nurse-to-patient ratios in the interests of patient care. Labor will deliver them in the interests of patient care and will go further. We'll legislate those ratios in government to ensure that future governments are bound by these ratios. 840 additional nurses. Good news for nurses and patients in New South Wales.
What matters to me is that people using paediatric wards are able to get the nurse ratios that they need. What matters is that when people come to an emergency department, they can get the nursing attention they need without our nurses being even more overworked and working more intensely than they all are.
The promise given today to provide a 1-to-3 ratio in emergency departments is long sought after by our members, and particularly in our members right across the state, not just in our large metropolitan hospitals, but in our rural centres as well. The promise of a ratio of 1-to-3 in our paediatric units is also welcome news. And the promise that the current ratios would be legislated is also welcome news. That makes it a lot harder for people who are trying to manage the budgets, the bureaucrats, to think that they can shave a bit off to cut some costs at the expense of nursing numbers and safe patient care. We do say that the campaign to extend our nurse-to-patient ratios to areas not yet covered will continue, and we will be urging both the current government, the Liberal National Party, to actually come forward and match or better this promise, and we'll continue to campaign for safe patient care right across New South Wales.
At the moment we are really struggling. If we have a full ward and there's only 2 nurses rostered, and it becomes very hard to deliver the full care to the patient, and especially when we are dealing with relatives as well as patients. So an extra pair of hands will be really, really good.
Resuscitation bays, it'll be a 1-to-1 ratio, which is fantastic news because currently that's not how it is. This is the best possible thing that could happen.